Hi everyone, I'm David White. This is Healthcare Like a Boss. Thank you for coming by the channel, and please subscribe to this channel and share its existence as well as this video with your friends. So, medical error, a big time killer. I understand that feels a little bit like clickbait, and maybe it is, but just a little, because consider this. It's estimated that 250,000 people in this country die every year as a result of medical error. 250,000 people in the United States die every year as a result of some type of medical error, not because of something they have done or failed to do, but because somebody messed up. Medical error is the third leading cause of death in this country, behind heart disease and cancer. So it's a big deal, clickbait or not. Now, the purpose of this video is to offer you 6 very simple suggestions to help you keep from becoming part of that statistic. Now, for context, these numbers that I'm throwing around come from a study that was done by patient safety experts at Johns Hopkins University in 2016. It was led by Dr. Martin Makery. It was written on again, it was reported on again in 2018 by CNBC, and I'm linking all of that below so that you can read that for yourselves. But I do want to read this definition of a medical error for clarity, so we know what we're talking about. I've blogged on this topic previously at the healthcient.com website. I'll link that below too. But consider this, quote, Dr. Makery defines a death due to medical error as one that is caused by inadequately skilled staff, error in judgment or care, a system defect, or a preventable adverse effect. This includes computer breakdowns, mix-ups with the doses or types of medications administered to patients, and surgical complications that go undiagnosed. So the question becomes, what can you do about it? And a short answer to begin with is everything you can. You've got to be aware, you have to be paying attention, you have to question things, you have to do everything you can do. You cannot be too careful. But 6 things, very succinctly. Number 1 is know everything there is to know about any new medication that's being prescribed for you. Know its side effects, its downside, know how it interacts with other medications, even your over-the-counter medications. Make sure your doctor, the prescribing physician, knows about all of your medications, including those that are over-the-counter. Know everything there is to know about your new medications being prescribed. Medications interact in some crazy ways and can be incredibly problematic. That's number 1. Number 2 is like it. Know everything that you can know about any recommended surgery or procedure or any type of somewhat invasive treatment plan. Know what there is to know. Know what the risk and the downsides are. Ask why it's being recommended. Ask what would happen if you don't have that surgery or procedure. Ask if there's some intermediate step. Is there something that you can do between where you are at that moment and surgery? Is there something having to do with lifestyle or a natural remedy or behaviorally? Is there an intermediate step? I mean, the best way to not be victim of a medical error is, not be on the table, right? So that's number 2. Number 3, simply get a second opinion. If anything that you encounter is unsettling to you, if anything gives you pause, get a second opinion, and maybe even a third. And by the way, if your doctor balks for some reason at you getting a second opinion, it might be time to get a new doctor. That's number 3. Number 4 is really important. In any way you can, via your patient portal, through your doctor's office, or however you can access it, look at your electronic health record, your EHR, or electronic medical record, your EMR, and check it, scour it for completeness and accuracy. You simply cannot trust that the information in your medical record is accurate or complete. Check the simple things like the spelling of your name and your birth date. That's important. Make sure your labs are there. Make sure your medications are there and up to date. Make sure your allergies are there, your medical history, your family history. Make sure it's all there. You simply cannot trust that it is complete and accurate. My wife recently had a surgery, and while we were in pre-op, her pre-op nurses were looking at her record in her EHR, and they had her height at 174 inches. That's 14 and a half feet. So number 4, make sure your medical records are complete and accurate. Number 5 is just common sense. Like every other part of your consumer life, read reviews, ask around. What's the reputation of this physician or this clinician? What are the Google reviews? But be smart about it. If you have one reviewer who's given a person 5 stars, that's not worth very much. But do some research. What's the success rate? What's the reputation of this particular physician? But check the source. And then number 6 is simply this: expand your team. Who do you know, your friends, your family, an objective third party that can help you think through this decision-making process as it comes to your health care, to a procedure or surgery, a medication or whatnot? Who can bring some clarity to that equation? Expand your team. Those 6 things, very, very simple, but may very well help you from being a part of this horrific statistic. David White, Healthcare Like a Boss. I'll see you next time.